Aortic stenosis is narrowing of the aortic valve. The aortic valve is one of the main valves of the heart. The heart usually squeezes blood out of this valve to the rest of the body. When the aortic valve narrows, the heart is working too hard to pump blood outside of the valve, and the rest of the body suffers. Signs and symptoms of aortic stenosis: chest pain would be first. Symptoms of congestive heart failure, like shortness of breath with exertion, swelling, and also passing out spells. Unfortunately, medicines don't work for aortic stenosis. Once your aortic stenosis becomes severe and symptomatic, we have to replace that valve. For patients who have symptomatic severe aortic stenosis, surgical open approach has been the traditional way to replace that valve. A new way to fix our narrowed aortic valve is TAVR, T-A-V-R, and that's a catheter-based approach that's done via access through the groin. That would deliver basically a stent that has a new valve inside of it that will replace your degenerated and diseased aortic valve. This is an aortic valve. It usually has 3 leaflets. When it's diseased, it's thickened, it's calcified, and it lacks mobility, so it does not open. You basically can't put a finger through it. When we do surgery, we usually take it out, put a new valve. In the new approach, TAVR, what we do is we put a stent that we deploy and open, which basically moves the old valve to the wall and replaces it with a new valve that is nice and thin and has wonderful mobility, and you can basically see that my finger can go through. And thus the heart is able to squeeze through that valve with ease and without much effort.